having some medical complications for myself, looking at things going on and trying to figure out what was causing me not to feel well, and having traditional physicians kind of steering me towards looking at going out on disability and to stop working because I wasn't feeling well. I started researching functional medicine on my own, and that kind of led me to MedMatrix to try to see if there was other alternatives for me instead of looking at to quit working, because I wanted to continue because I love what I do. Even though I work in traditional medicine myself because I'm a nurse, I didn't want to stop working. So that's what led me here.
Amazing. So and you came across an ad?
I did. I came across an ad because most of the functional medicine, when I was doing the research, most of the practices that I was finding was down in the Boston area. And so I was looking for something closer to home that wouldn't be so far to travel.
What were some of the challenges you were facing every day?
I was facing like brain fog, fatigue. I was having some balance issues, so it was hard to concentrate at work. I was working full-time doing my job, and then I was just exhausted on the weekends, so I was taking the weekends to recover. So I really wasn't having any time for myself or my husband to do anything, so I was spending most of my time on my weekends in bed recovering, so then I could get back up on Monday mornings and do the whole week again.
Going on disability.
Yeah, so the doctors were recommending that I apply for disability and stop working because they felt that I would qualify for disability. I ended up having some cardiac issues, and then later on I ended up having a brain tumor that I had removed, and that caused some residual issues with my balance, hearing issues, and some concentration and things like so.
And about your experience during here. So your first interaction with the ad was called. Do you remember any call?
Yeah. So we went over different issues that I was having. We talked about brain fog, the fatigue. I was having some joint problems, aching, things like that. The balance issues, the concentration issues. And when we talked about my age, I was kind of in that menopausal age group. So when we discovered everything that was going on, it may not have just been like the brain tumor and that type of thing. It could have been other things that was causing those issues with the brain fog, the concentration, things like that. So when I was talking to the in-person, they were like, well, why don't you come in, you have blood work, and talk to somebody here to see if maybe there's other things that could be also interfering with those, bringing on those issues other than your medical complications that you've already been having.
Okay. And then, so overall, you recall, how did you feel afterwards? Like going in, post, were you skeptical at first? Some people come in, they're like, I know what I'm looking for.
I know, coming from traditional medicine, you always think, the symptoms, and there's always, a diagnosis there and stuff. But after talking and listening, it's like, it's not always just one specific thing. There could be other causes for, vitamin deficiencies and that type of thing, hormones that could be causing it.
Okay. And then that initial lab visit, when you came, got your labs done, and then that InBody scan, how did you feel about that with our team, with the process, with the information?
Everybody was so professional, friendly, nice. It was really amazing how they made you feel. They were welcoming. It was just a different feel here than like a traditional medical office that you go to, and everybody is so focused. Just the one symptom you're going in there for. They're not looking really at you as a whole person to what else could be causing things.
And then that InBody, have you done one before, a body composition?
I had not done one before. That was the first time.
Okay.
So.
And how did you, some people are like, okay. Some people are like, wow, I didn't know all these things.
Yeah, I didn't until they were all explained out what they were actually looking at. And
then what about that provider? Who was your provider?
Dr. Rose.
Dr. Rose.
Yeah.
So going into that visit, do you remember feeling any way and then coming out, or how did it go in general?
I remember I had to fill out a questionnaire before coming, and like walking in there, like she already knew everything about me. Everything that I had written down, she knew. And then all the lab work, she went went line by line through every piece of lab work with me and explained it all out. And it was amazing how everything connected to what I was feeling, all the symptoms and the things that we discussed, and her kind of take on what I was feeling, the symptoms I was having, how they connected with like the brain fog, concentration issues I was having, the balance issues, the joint issues. And I have to say, coming into here, I had been going to physical therapy for over a year and a half. It hadn't made a difference. I hadn't seen one bit of difference in physical therapy. I felt like I had almost wasted a year and a half of my life going to physical therapy. And I came here, she had made some recommendations for some peptide injections. I did some hormone therapy, and now I wasn't able to lift my left arm over my head. I could barely lift my left arm, and now I have full use of my left arm, my shoulder. It was amazing, the difference that it made.
That's actually incredible. Yeah. So those challenges, how has it impacted your daily life now?
I am back to I can sleep 6 to 7 hours. Before I was barely sleeping 3 hours a night. I'm back to functioning on the weekends. There's no longer this full staying in bed over the weekend. I am actually active on the weekend. Me and my husband are out doing things. It's no longer a cycle of working my week and then taking the full weekend to recover from that work week. So I feel like I'm a normal person again.
Functional medicine in general, not a lot of people know about it, right? So how would you describe functional medicine to somebody?
I would say that I feel it works in conjunction with traditional medicine. I still see my regular PCP, but it works in conjunction with that. I think there's definitely a place for it. I will never go back just regular traditional medicine. I'll keep it working side by side together. I feel that there's always going to be a place for it in my life.
And what about somebody who's on the fence about functional medicine? What would you say to them?
I would say that there's definitely a place for it in everybody's life. I think people need to look at it as a whole. Traditional medicine seems to just look at a specific symptom. It doesn't look at the whole body as a whole. What else could be causing that symptom? There's so many different things that could be causing it. Like I said in the beginning, it could be a vitamin deficiency that could be causing it, not necessarily when somebody has muscle problem or brain fog or something. It may not be a specific. Some people may think it's something to do, like I have somebody who has migraines and they're always thinking, oh my God, do I have a brain tumor? Do I have it may not necessarily be that.
Yeah.
It could be simple as a hormone or a vitamin deficiency. Like I said, it may not be something simple as something terribly wrong with you. So it's, you have to look at the whole person.
I've asked all my questions. Is there anything else you want to share?
I think people get in their head that traditional medicine is all there is out there, but I think they need to look further into functional medicine. It is diet, it is exercise, it's everything being involved. It isn't just, a pill, or you have to look at the whole thing, the whole picture.